Good morning and welcome to this first edition of Keeping an Eye on the Geopolitical Ball in 2021 with me, Jamie Shea, Senior Fellow, Friends of Europe here in Brussels. First of all, let me wish all of you a belated but nonetheless sincere Happy New Year. As we put 2020 behind us, which was very much for all of us, many of us, a lost year due to the impact of COVID-19, we were undoubtedly hoping that in 2021 we would increasingly emerge from the pandemic and be able to focus our attention on other things, because God knows there are several big issues in the world, like the pressing impact of climate change, that need our attention. But as 2021 begins, it looks as if it's also going to be a year dominated by the pandemic. The situation in many countries seems to be getting out of control, certainly getting worse before it gets better. Even countries like Germany, which seem to be doing very well coping in the first round, are now experiencing more than 1,000 deaths a day. And therefore, if we are going to be able to get back to normal soon, it's important that all governments focus, in my view, on five urgent things so that we can finally and quickly get on top of the virus before it inflicts lasting and devastating economic damage on us in terms of loss of jobs, before it complicates our health situation for generations, in terms of all of the people who will need to be treated long term, and all of those people with cancer or heart conditions who have been denied treatment because of the priority given to COVID, or all of the children who have missed out on their schooling and education because they can't work remotely, and of course the failure of governments to pay attention to other things like conflicts in the world as everybody is in lockdown mode. What are those five things? Well, the first thing is to recognize that vaccines are not going to be a panacea in the short run. It's good news that we have vaccines, but it's going to take a while for them to be rolled out fully. The new variants that we've seen from the UK or South Africa unfortunately mean that we now have redefined herd immunity as vaccinating 80 to 90% of the population rather than the previous 60%. We don't know yet if the vaccines are going to be effective at stopping the spread of transmission and not just getting sick, if they are going to last for a long time, if they're going to be effective against new strains, and so on. So the first bad news that governments have to communicate to their populations is that even though the vaccines are on the horizon, for many months yet, we are going to need to observe social distancing, wearing masks, washing hands, and spending, unfortunately, still much of our time cooped up at working from home. The second thing is that governments need a much more dynamic and faster rollout of the vaccines. If they are the one and only hope of emerging from COVID, then we need to get as many shots in as many arms as quickly as possible. And the campaigns in many countries are going very slowly. In many EU countries, they started only last week. But Israel, which has already vaccinated 1/5 of its population, shows that it can be done by using the military to set up centers, by calling up former doctors and nurses and pharmacists to help, by making sure we don't waste vaccines, by not waiting to have vaccinated everybody in one group, such as people in healthcare homes, before we start vaccinating others. We need a nationwide effort, similar to a wartime situation, to deliver the vaccines more effectively. The third thing we can do is to have a look at some of the non-Western vaccines like Sputnik 5 from Russia, or the Sinovac or coronavirus from China, and see if we can also certify them for use to have even more vaccines. Now, this may sound controversial because, of course, these non-Western vaccines have not been tested or certified in the same way as, for example, the Pfizer vaccine. But if they do work and are effective, we should see to what degree we can certify them and use them as we go forward. The fourth thing that we need to do is not to hog all of the vaccines ourselves. So far, about 80 to 90% of all of the vaccines being produced have been sort of pre-reserved by Western countries that have put in large orders, with the result that Canada has 5 times more vaccines on order than it needs to vaccinate its entire population, and the UK 3 times more. But the developing countries, of course, are at the end of the queue. But it's very important that we use our excess vaccines quickly to transfer them to these developing countries through programs like COVAX, funded by the European Union, because we are only going to be safe when everybody around the world is safe and normal business and travel can start up. Finally, unfortunately, we know from everything that COVID-19 is not going to be the end of big pandemics. Indeed, 3/4 of all of the pathogens that scientists are discovering at the moment are viruses. So there will be further pandemics in the future. And the crisis so far has shown up severe weaknesses in our systems, in government communications, for example, in access to public health systems, the resilience of public health systems, the fact that wealth inequalities largely determine who gets treated and who remains healthy as well, the failure to stock and pre-position testing or medicines or personal protective equipment and so on. So it's very important that we start learning these lessons now and make those kind of improvements in our resilience so that we are more ready to cope with the next crisis when it comes. It's very useful in this respect to have seen that Joe Biden, as he prepares to assume the presidency, has reinstated in the National Security Council the special department dealing with pandemics that President Trump eliminated. That is a good sign of leadership, which all leaders around the world will need to emulate in the months to come. Thank you very much for watching and listening, and I look forward to engaging with you again next week.